Chapter 11 Tube Care Part 1. Which of the following is not true regarding the types of an nasogastric tube? A. Cantor tube is a single lumen long tube with a small inflatable bag at the distal end. B. Miller-Abbott tube is a long double lumen used to drain and decompress the small intestine. C. Levin tube is a double lumen nasogastric tube with an Arvent. The sense-taken Blackmore tube is a three-lumen tube. The correct answer is C. Levin tube is a double-lumen nasogastric tube with an Arvent. A newly RN nurse is about to insert a nasogastric tube to a client with Guillain-Barré syndrome. To determine the accurate measurement of the length of the tube be inserted, the nurse should A. Place the tube at the tip of the nose and measure by extending the tube to the earlobe and then down to the top of the sternum. B. Place the tube at the tip of the nose and measure by extending the tube to the earlobe and then down to the xiphoid process. C. Place the tube at the tip of the nose and measure by extending the tube down to the chin and then down to the top of the xiphoid process. D. Place the tube at the base of the nose and measure by extending the tube to the earlobe and then down to the top of the sternum. The correct answer is B. Place the tube at the tip of the nose and measure by extending tube to the earlobe and then down to the xiphoid process. The stroke client who was initially on NGT feeding was able to tolerate soft diet, so the physician ordered for the removal of it. The nurse would instruct the client to do which of the following before he removes the tube? A. Inhale and exhale simultaneously. B. Take a long breath and hold it. C. Do a Valsalva maneuver. D. Blow the nose. The correct answer is B. Take a long breath and hold it. The nurse is preparing to give bolus enteral feedings via nasogastric tube to a comatose patient. Which of the following actions is an inappropriate practice by the nurse? A. If bowel sounds are absent, hold the feeding and notify the physician. B. Assess tube placement by aspirating gastric content and check the pH level. C. Warm the feeding to room temperature to prevent the occurrence of diarrhea and cramps. D. Elevate the head of the bed to 45 degrees and maintains for 30 minutes after installation of the feeding. The correct answer is D. Elevate the head of the bed to 45 degrees and maintains for 30 minutes after installation of feeding. A nurse is checking the nasogastric tube position of a client receiving a long-term therapy of omeprazole by aspirating the stomach contents to check for the pH level. The nurse proves that correct tube placement if the pH level is A. 7.75, B. 7.5, C. 6.5, D. 5.5. The correct answer is D. 5.5. Before feeding a client via NGT, the nurse checks for residual and obtains a residual amount of 90 ml. What is the appropriate action for the nurse to take? A. Discard the residual amount. B. Hold the due feeding. C. Skip the feeding and administer the next feeding due in 4 hours. D. Reinstill the amount and continue with administering the feeding. The correct answer is D. Reinstill the amount and continue with administering the feeding. Continuous type of feeding is administered over a dash hour period. A4, B12, C24, D36. The correct answer is C24. A client is subjected to undergo a chest X-ray to confirm the endotracheal tube placement. The tube should be how many centimeters above the carinum? A. 2 to 4 centimeter, B. 1.5 to 3 centimeter, C. 1 to 2 centimeter, D. 0.5 to 1 centimeter. The correct answer is C. 1 to 2 centimeter.